Hi, I'm Dr. Zachary Hanson from Loma University Medical Center. Under the direction of Dr. Akhtari in the Medical Cancer Center, I've done a research project that I'd love to present to you guys. And so what we've done is we've done a retrospective review over patients with chronic anemia that were also found to have zinc deficiency. And so what we've done is we've looked at these patients with zinc deficiency that were supplemented with supplemental zinc, and we've tracked their hemoglobin over time. And the reason that we've done this is that in many developed countries, many of their food supplies have been fortified with zinc supplements as well as iron, folate, and B12. And we've noticed that there has been improvements in hemoglobin. And so it begs the question for patients who have chronic anemia of unknown other etiologies, where where things like iron have already been supplemented, B12 and folate are normal, is there a role for zinc in supplementation to improve these patients' anemia? And so we found 43 patients that had concurrent zinc deficiency with anemia, and they were followed for about a year with hemoglobins followed at 1, 3, 6, and 12-month time markers. And what we found was that these patients had baseline hemoglobin at around 10. And then after 1 month of supplementation, there was no significant improvement in the hemoglobin, but we did quantify that the average hemoglobin was 10.6. At 3 months, there was a statistical significant change where the hemoglobin came to 10.9. At 6 months, it improved to 11.2. And at 12 months, the hemoglobin stayed at 11.2. Overall, we were able to find that 40% of these patients had a complete resolution of their anemia based off of their gender. So overall, we could also look at this in a descriptive way based off of, at each time marker, how many patients started to improve in their anemia. So what we found is that at 1 month, patients that had 0.5 improvement in their hemoglobin, there's about 54% of those patients that showed improvement. And then patients that had a one hemoglobin change was found in about 43%, and that was found in a stepwise improvement over those 12 months. So overall, what we found was that zinc supplementation significantly improved patients' anemia, with a resolution of anemia found in 40% of the patients, that improved in a stepwise manner. So as a retrospective study, this is a launching point for a further question if zinc is an erythrocyte stimulating agent for these patients and needs to be supplemented in our chronic anemia patients that aren't found to have other etiologies. There are currently other studies that are ongoing at Loma to determine the pathophysiology of the zinc supplementation and why this works, as well as this study continues to undergo recruitment as well as follow up with these patients. Thank you for your time.